So if you're a woman dealing with brain fog, fatigue, irritability, gut issues, and just not feeling like yourself, you have two paths. Number one, you can consider going to a traditional doctor that may give you 5, possibly 10 minutes, and then give you a list of prescriptions and say, hey, go take these and this is going to fix your problem. Or you could take a different approach, and that's go to somebody that actually looks at root causes, concepts, those things that are driving the issues that you're having, and come up with solutions to actually make you feel like you want to feel. And that's what today's podcast is all about. I'm joined with one of my good friends, Dr. Sakina Davis, and we're going to talk about root cause medicine. But one of the things that she sees a lot that makes people feel lousy, and I'm looking forward to it. Sakina, thank you so much for joining me.
Thank you so much, Steve, for having me on today. I appreciate it.
Awesome. So I want to tell you a little bit about her. Dr. Sakina Davis, she's a fellowship-trained functional medicine prescriber who specializes in root cause medicine, but also treats chronic conditions, things including like autoimmune conditions, gut health, etc. She also is very comprehensive, patient-centered approach with combining true testing, lifestyle medicine, and targeted therapies to help patients truly feel the way they want to be, heal, and not just manage symptoms. And that's what today is all about. So one of the things, Sakina, you and I know right now that's kind of everywhere is like autoimmune conditions. And I feel like those things get hidden in every thing else. But like in terms of like, what are the common symptoms that you see patients don't realize that could be like an autoimmune condition that people just show up with that they don't have no clue? You start looking into it and you're like, oh my gosh, I got to tell you about this.
Right. Well, so this is my everyday scenario, right? So I have women that come to me. They've been to multiple other physicians. They've asked them to draw labs. They've told them something is wrong. So they're hurting. They're having pain. They're tired. They're losing their hair. Their skin is all dry and crepey, and they just cannot figure out what's going on. And they try to discuss this with other providers and are told, well, all your labs are normal, so everything's fine. So then they just go on their merry way, right? And that is the typical case scenario, whether they're in their 20s, their 40s, their 60s. I mean, it can definitely occur at different ages, obviously. But it is so frustrating, mostly for women, but I also see men with the same issue as well. And it is just all those little, nagging things that are showing up that you're like, is this normal? Is this supposed to be happening?
Gotcha. And so if you look at patients and they come in, and as well as me, in a traditional setting, honestly, I think they get billed out or booked out about 10 minutes of time. To figure out what's going on with the patient, can't do that in 5 or 10 minutes.
No.
But with that said, how long does a typical visit take? I mean, when they come in and you're really trying to get to these root causes, what does a typical visit look like?
Well, a typical visit in my office will be at least about a 45 minutes to an hour, just initial consultation and evaluation to discuss symptoms. I think we have to get down to the deep and dirty, like what is actually going on? How long has it been going on? Were there any triggers that could have happened prior to this? Did you have COVID? Did you have something that could have triggered something like this? So it definitely takes time. And, it's not the fault of the other physicians, I will say, in traditional medicine. I do want to give them a little credit. That is just the scenario under insurance, is that you have to really pretty much get everybody in and out in like 2 minutes, right? So I think when we run practices like we have to take that time in order to actually help you. And that is why we have the ability to do that. We have time to ask you about your lifestyle, your nutrition, your exercise. What are you doing in your environment? Have you moved to a new environment? All these questions are so important. And I know that when I was in traditional medicine, well, first of all, we didn't know to ask the questions. And then second of all, we didn't have the time. So I'm very blessed that I'm able to do that. But it is really, you have to take the time to really dive deep to get into, the nitty gritty of what's going on and what could be the root cause of what's happening.
So right now, it seems like on the internet, everything is either, hey, you have a hormone issue,
right,
or you have stress.
Right.
Like that's the drivers of everything.
Yeah.
And I agree. Those are important.
Yes.
But one of the things I think you and I both agree we're seeing more and more of is like immune dysfunction issues, autoimmune conditions, and things like that. What are the patterns, if somebody has like immune dysfunction, autoimmune conditions, what are those patterns that you typically see show up in your office that starts making you think, ooh, I've got to dig a little deeper because there's something else going on, just versus somebody doesn't feel bad or feel good or they have hormone issues?
Right. Well, again, first of all, I think that fatigue is a huge one. So, lack of energy, change of energy, that will make a huge difference. I've seen a lot of skin issues that are like, what's going on with that? Change in gut health. So sometimes if they're having issues with irritable bowel syndrome or what they think is irritable bowel syndrome, that could signal certainly a change. Joint inflammation can definitely be something that I'm going to look at. Family history, to be honest, there are obviously, many of our autoimmune issues like Hashimoto's, rheumatoid arthritis, they can have a family history, a genetic link for sure. So it's that pattern that I start to see. And honestly, because I have Hashimoto's myself and I have PCOS myself, it helps me because I know I sort of listen to those symptoms and I'm like, I clue in pretty quickly because I think when you have it yourself, obviously you're going to be a little more in tune with what they're saying. And I think if you're not someone who has ever experienced something autoimmune, then you don't really know to listen that way or look into to those types of symptoms. But really, I think it's mostly the joints, the fatigue, the skin, change in bowels, weight gain. Those are all big things that are signaled to me.
So when a patient comes into your office and you start suspecting autoimmune conditions, we'll talk about testing in just a bit, but you think there's an autoimmune condition, how exactly do you explain that to the person so they get an understanding of what's going on when somebody has an autoimmune condition or there's a possibility of that?
So the way I explain that is that there's something that has triggered an immune response in your body that is driving inflammation. And where is that inflammation coming from? That's what we have to get down to the root of. And we need to decrease that inflammation and work on restoring the body's immune system. So I tell them that basically there's some type of trigger, and it can be anything from traveling and getting a bug bite or, traveling and getting some type of GI issue to any type of, recent illness like strep or flu or COVID. I mean, there's so many things that can trigger a response in our immune system. So once I can get down to what happened, when, how, then we can figure out what potentially set off the immune system and then start to drive into how we're going to get down and decrease that inflammation.
So when you look at autoimmune conditions, when I was in pharmacy school, I do remember like Hashimoto's, and I probably remember like rheumatoid arthritis,
right,
maybe psoriasis.
Right.
But tell me nowadays, you're doing a lot of testing. You see a lot of patients. What are the big autoimmune conditions now that are just like showing up like almost like commonly versus just, oh my gosh, I had a patient show up with this today?
Well, first of all, POTS. We never even knew what POTS was, back 20, 30 years ago when I was in training. And now it's definitely a huge issue. MCAS is a huge issue. We're seeing more and more people who have what I would call unusual autoimmune conditions, more Sjogren's, more, other types of things. And honestly, to me, whether we label the name of what it is or we don't, once we know that there's an immune issue, I really have the same plan of attack, to be honest. I want to fix the immune, I want to fix the gut. I want to fix the inflammation. And it doesn't really matter what the label is. I think I just have to figure out how to drive down that inflammation and heal the immune system. That's my whole goal. So, but we are seeing a lot of, again, immune issues that were very rare and not even discussed with us or taught back 20 years ago.
So you mentioned pots. So we'll just not take a deep dive, but somebody may have like pots. That's like something you cook with. That's obviously not what we're talking about.
No.
But with that said, for people that have that, that's a very serious condition. And a lot of times people don't put those symptoms together. What is somebody that shows up in your pots? What are they typically? What goes on with those patients?
So they usually come in and they have usually a very high heart rate. That usually will occur just from, moving in the very, like standing to, sitting to standing, something like that. They're very dizzy. They're lightheaded. They have extreme fatigue. They really can't, honestly, sometimes some of them can't get out of bed. I think they have a lot of joint aches and pains. So, there's a whole conglomeration of what's going on with POTS. It's a very, very difficult, I will say, immune issue to manage, but very critical that we at least identify it and then, do a lot of symptom management after that.
And I think that's a good call out on something like that. You would think autoimmune conditions, it attacks a tissue. Hashimoto's the thyroid, psoriasis, the skin. But in POTS, it's almost like a neuronal type thing where the brain loses control of the things that we all think about, blood pressure regulation, heart rate. And so people wouldn't even think the immune system could do that kind of stuff. I guess it shows the power of getting the immune system under control. We'll take a deep dive a little bit into treating these conditions, but where do you think the conventional system gets that patient walks in with these exact things you're talking about? Where do you think the conventional system gets things wrong and maybe sends people down the wrong path in terms of really trying to help them be their best self later?
Well, unfortunately for women, if you have more than one or two symptoms, they assume that you're depressed or anxious. And so they put you on an antidepressant and then there's no other discussion. That's really about it. That's really what I was even taught back in the day of medical school, is that all these complaints signal that there's underlying depression and anxiety. And that is very, very frustrating because of course there is true mental health and depression, anxiety, but these signs are definitely more related to other changes in the body that you weren't expecting. So I have so many women that come to me and say, look, I've been told that I'm depressed and anxious. And guess what? I am not. I'm not depressed. I'm not anxious. I love my life, but I want to be able to get up and run and do all the things I used to do and have the motivation I had and enjoy traveling, the things I did with my family. And now I just can't do anything. And that just breaks my heart because I know that, in the conventional system, it's just here's your, antidepressant and go on your merry way.
So with that said, if a lady comes in and says, I've been even told I have an autoimmune condition.
Right.
Is there hope for them? I mean, is there things that you can actually do in the office to actually, have you seen patients? Do you have a patient story where somebody come in with a debilitating autoimmune condition and all of a sudden they're actually able to live and function a normal life, even though in the past they probably were told they couldn't?
Oh, I'm so blessed. I've seen several of those. I mean, I have a, patient in mind. She literally came in, she had immune inflammation from COVID. And it took us quite some time to get her immune system under control with a combination of nutrition, and supplements, medication, IV therapy. But with that, we were able to really restore her life and she's running again. She's able to get up and go travel again. She's able to get out of bed. I mean, she was just at the point where she was not able to really live a normal functional life. And I've had more than that, definitely more than that case scenario. But I mean, I've had CEOs, executives, people who have just overstressed their bodies to the point that they can't function. And that has triggered an immune issue for them. And we've helped them, rebuild their immune system basically. And that gets them back and running, back to normal for them.
And I think you brought out a good point right there. And that is a lot of times, many of the people that show up in your office and that I see too are really high performers. They're pulling, doing so many other things, which are such big drivers of all that. And they don't have time to slow down and take care of their health. But you and I both know, autoimmune conditions, they don't start the day they show up in your office. These have been going on for years, and it isn't until they begins to affect daily function, but that damage has been done. So trying to reverse that does take more of a holistic approach, functional, looking at all the root causes. So
right.
Somebody comes to you and you think, all right, I'm hearing autoimmune conditions. What are the labs or what are some of the things you like to do that you think doesn't typically get mixed? Because many people, they'll run basically metabolic panel, CBC, maybe do a TSH on thyroid. Well, everything looks good. I don't really see any issues here. Let's just try this. How do you take a different approach when it comes to testing?
Well, we do a lot more testing than that. We do a very expanded thyroid panel. We check antibodies and let's set a sideline on Hashimoto's. I think actually now some physicians are starting to run the antibody levels. And even if they're high, they tell them, oh, that's fine. That's normal. That's just part of what's going on. So sadly, I don't even think they know what to do with that or how to approach that or interpret it or treat it. But anyway, so we draw, thyroid antibody levels. We draw usually a screening panel for something like an ANA, SED rate, looking for a lupus, looking for inflammation, a CRP. And then we have an entire immune panel that we can even look further at markers for mold, for toxins, that we can look for other markers like IL-6, beta-NK. I mean, it can go on and on and on. And I think that my clue is not even so much in the labs, it's in their history. It's in their appearance. It's in the inflammation that I can see going on with them. So it's really a clinical picture. And then if I definitely can choose lots of different labs to back up what I'm thinking. But again, I think that inflammation now I can recognize just honestly by the time I see them. I can see the inflammation in their face. I can see it in their hands. I can see it in their legs. I mean, it's very recognizable, when you've done this for 20 years and have that experience, I think. But labs are definitely important. And we have a whole variety. We love Vibrant. That's one of the companies we work with. And they're offering more and more technology and testing for us. That's opened up a lot of doors for us too.
So you mentioned some inflammation labs that you do. And I think that is critical because I feel like a lot of practitioners run away. They won't check like HSCRPs, or you mentioned IL-6, which is an interleukin, which is a marker of inflammation. We need some of that, but when it gets out of bounds, it says, hey, immune system's hyper alerted and things are going on. For you, you mentioned this, it's not the end all be all, but if you have all these other symptoms, you add that to it. That's kind of like the checkbox. Okay, we've got to take a deeper dive. Is that for you? Do you feel like as these more advanced tests come out, it makes your job easier, or just gives you another extra stamp to say, yes, I'm on the right track? How do you look at these advanced testing labs? Because some people will say, that's the problem with functional medicine. We over test, we spend all this money. What is your take on that?
So I think we can. I mean, I do agree with that. Sometimes we can get into the minutia of drawing, 14 tests, and then we're like, okay, like we knew that. We had some of this information, just like I said, by clinical picture. So I feel like I try to be very specific about what I want, because I don't want to draw so much that it's overwhelming for me and for the patient. I want to draw enough that it identifies that there's inflammation, and it identifies it in black and white, so I can show it to the patient and say, look, these are the markers that I'm looking for. This is what I'm seeing. And then these are the things I can follow a trend to see if they improve. But I don't want to over test everything at one time, because then I think it's too much for me, it's too much for the patient. And I think then we are overly stimulated with that information, and that's not helpful either. So I think we have to pick and choose carefully. And sometimes I do see that people come in and they've had, 45 tests from 40, from different doctors. And whereas that can be helpful, sometimes it's just not necessary, So sometimes I just look at the clinical picture and I'm like, you know what? This is what we're going to do. We're just going to start the process. We're going to work on this. We're going to do this, and we're going to see where we go. And if I find that I can't do what I need to do, sometimes I'll draw additional markers after that. But I try to draw mostly what baseline that I feel will help identify it, so that I can show the patient, here's an inflammation level that I can show you, and this is what I can do to help decrease that.
Yeah. And in working with you, I feel like you do take a good stepwise approach. It's kind of, let's learn this initial pattern, and if we need to dig deeper, we can. Because you know as well as me, we keep getting hit. We can run the number of the detail that's being able that we can run nowadays. It's just so kind of out of control.
It is a little out of control. It is. It is.
Yeah, the labs just keep saying
there are some people that want all that. They want every piece of piece of data that they can get, and if that's what they want, that's what I'll give them. But like I said, sometimes if I know the pattern of what's going on and I can work with it, I feel like it's better to also work just with a clinical picture.
Now that's some great information. So we kind of mentioned some of the things you look at. We mentioned, and you said something else too. Actually, this is what I want to ask about. So when you follow trending, and you mentioned that, because some of these markers, I have to admit it, I mean, they're just markers of inflammation. Do you typically see trending in these markers truly relate to patient symptoms? Or are there times you see that the markers trend one way, but symptoms go the other way? Give me your thoughts on that.
So I've seen both. Now with Hashimoto's, I can say pretty definitively that I see inflammation improving when I see the antibody levels decreasing. So that I feel like is a very good marker for me to follow with therapy, nutrition, LDN, which I'm sure we're going to talk about, all of that. So I can actually show them, hey, your number started at 500. Now that's 200. Now we're down to 70, so that's a great marker to follow. Sometimes I find that the markers, like an ANA, I might be looking at it and it's a titer of 1 to 80, and then it goes to 1 to 320. And then all of a sudden it's nothing. I mean, so that can be, a little bit harder to manage and follow. And I think at that point, I'm not necessarily trying to get a number to 0. I'm trying to get the patient to feel better. So there's some markers that I feel like I work with, and I want to show them that there's an improvement, and it will help them to be more motivated to stay on a no gluten diet or whatever I'm going to put them on. And then there's some markers that I don't think identify with sometimes the patient's feeling great and their markers are not. So I think it can go either way.
So I'm glad you brought up the Hashimoto's, because I've done several podcasts, and some are like the antibodies are important, some are not in terms of trending.
Right.
I am of the belief that I do think it's important. They
Absolutely.
are truly a sign of whether or not. So let's say you put them on a protocol, you've got them fixed, their markers or antibodies are trending in the right direction. They feel better, and then all of a sudden your antibodies just start spiking again. Like what are the things that you go back and ask that patient to kind of dig a little deeper to see, hey, what is going on?
So what I've seen mostly is dietary changes, first of all. So some of them fall off their clean diet, which is completely understandable. Sometimes it can be from travel. Sometimes it's something that they developed, like I said, a gastrointestinal infection. They got bitten by a bug of some sort. Um, sometimes it can be that they got an illness like strep, flu, COVID, and that respiked their antibodies. So there's a lot of different things that can influence it.
No, that's great information. So one of the things you and I talk about all the time is gut health and how it drives so many other conditions. But I feel like gut health is one of the things that truly drives autoimmune conditions. Walk me through how gut health or, overall gut, how it's working can actually drive autoimmune conditions and either make them better or make them worse.
Well, I think our gut is under constant attack. First of all, as clean as we can eat, the chemicals in our soil, the toxins in our environment, it's just hard to live in this kind of environment and not be impacted by that, right? And so our gut health has changed tremendously from 1950. Okay, if you go back and you look at movies from 1950, videos from 1950, you see healthy people who are not overweight, who look like they're not shrinking away, and you can tell that the inflammation levels are lower. And then you look at us today, and we're a very different world. I think that when our gut is under constant attack, we eat the foods that are sprayed with all the chemicals like glyphosate, or our cows are mistreated and fed grains instead of grass, or the chickens are mistreated. So if we're not looking at how our animals are retreating, we're not looking where our fruits and vegetables are coming from, we're not looking at the chemicals in them. What about what we put on our face every day? What about what we do with our, brush our teeth? Wash our hair. All of those chemicals are affecting our insides. All of the chemicals you use in your house, So if you're using all the chemicals in something like Fabuloso, it's affecting your gut, believe it or not. And so I think people don't realize how much what you eat, what you put on your skin, what is around you affects what's happening in your gut. And when all that inflammation is in the gut, then it's been driven to your brain, it's been driven to your skin, it's been driven to your joints. So we're going to start to see all the effects of that.
And that's where I think the gut, I don't think a lot of people put together that immune system and is there with the gut. And the reason is, you're right, it's that one line defense that has to determine everything you put in your mouth that goes to your gastrointestinal tract. Is it friend or foe? And that's the reason that immune system is setting there to protect yourself. But when you, like you said, you have these outside sources that kind of, I hate to say, mask things or look like things or make that immune system not be able to recognize friend or foe, that's when things get out of whack. And I don't think many people realize how that real strong immune system connection is with the gut, as far as seeing where we get down the road with autoimmune conditions. So in the same line, one particular gut condition I think that now pretty much everybody will agree exists is leaky gut. How do you see leaky gut playing a role in terms of autoimmune conditions?
Well, they're completely connected, right? So if our immune system is so dysregulated and our gut is so inflamed, then, all of a sudden we start to see that the nutrients are leaking out, and that, all the good nutrients are not getting into the gut. And we're seeing all this immune dysregulation that happens that causes you to feel tired, and it causes you to not be able to go to the restroom, and causes you to have achy joints, and causes you to lose your hair. So I think that the gut health is incredibly important, so that we maintain our brain, we maintain our muscle, we maintain our ability to think clearly, all of that. Which is so odd to think that this is tied to our gut. Like, when I first learned this concept, to be very honest, I was like, this is crazy. How does our gut and the little bacteria in there regulate everything that's happening in my body? But we have trillions of that bacteria in there. And if we kill them off and we allow all these yeast to overgrow in there, we allow all these, all the chemicals to dysregulate the immune function, then it doesn't work, and then we don't work. So basically, there's a huge connection between immune system, autoimmune conditions, and your gut.
So when it comes to gut health, and the way that I try to explain it to patients is, if you've got a messed up gut, it's going to rear its head some way. Like you said, whether it be cognitive issues, it could be autoimmune conditions as far as that goes. But the one thing I'll tell patients is do you can do gut tests to kind of figure out what's going on in the gut and fix it? Tell me about gut testing. Is that something you use, and how do you put that in practice in terms of helping drive patients to where their desired outcomes occur?
Oh, that's definitely a huge part of what we do. Now, I will tell you, it's not a very fun test to do. I mean, I did it myself, and to collect your own stool, I'm sure you've done one too, is not a fun task. I will, let's just be honest, okay? But once we're able to send that information to the company and they're able to spit back to me all the different kinds of bacteria. I mean, how diverse is your gut with bacteria, good bacteria, bad bacteria, other parasites in there? Do you have any type of digestive issues? What are your inflammation markers? Do you have butyrate? I mean, all these questions are answered for us. And then we can tailor a specific program with specific nutrients, specific probiotics, prebiotics, postbiotics, whatever we need to do to heal the inflammation in there. So they are a big cornerstone of what we do. If I can get my patients to do that, which most of them will, I'm very honest. I will tell them if something's going to be painful, if it's going to not be fun to do. So I'm not going to be like, oh, it's easy. Don't, it's a little bit, I think that it's hard for you to, I think it's hard for people to look at their own poop. I mean, I think it's really odd. Like how many of us just watch and like, I don't want to look at that. I don't know what's going on, but I think you can tell a lot if you actually just turn around and look at that. And then when you have to collect it, you're like, this is very interesting. So it's actually quite fascinating.
Now, stool testing's pretty crappy. I agree. And you're right. Most people don't want to deal with it. But right. I think some people get to the point health-wise, like I have to do something different. They'll entertain being willing to collect it. So when you get these reports back, they're extensive. You mentioned so many things. What are like the 2 to 3 like red flags when you get a report back and you like, these are the 2 or 3 things that these are flashing red. I know this is the cause, and let's get to work on gut health. What are those couple things?
Well, I think digestion is huge for me. So when I see that there's an imbalance in how you're digesting, if I see meat fibers and vegetable fibers and you're not able to process those, that's very important to me.
So wait, stop right there. I don't think people realize that. You can take a gut health and determine if somebody's not digesting their food.
Yeah, you can look and see if there's enzymes that are being produced that are breaking down your fat and your protein, breaking down your meat or vegetables. Yeah, it's fascinating stuff.
You're bringing up a key thing. I don't think people realize they may not digest their food, even though they're eating the best diet in the world. I don't think many people realize that. Do you see that as a common issue?
Every day. I think that's huge. I think, we're not, I don't know why, but a lot of people, if they don't have a gallbladder, that's an easy answer to me. Okay, well, you don't have the organ that's producing the enzymes that need to do this. But there's a lot of gallbladder dysfunction as well. A lot of fatty liver issues. I mean, things that are preventing our pancreas and our gallbladder from working efficiently, and our gut, our stomach. I mean, there's so many reasons why this can be happening, but digestion for sure, I see as a huge cornerstone, because if we're eating all these foods and you're like, well, why am I not absorbing, vitamins? Why am I not absorbing these nutrients? It's because your body isn't able to produce the enzymes you need to digest it and get the amino acids out of there, the protein out of there, or whatever we need from there. So that's a big help for me for sure. I think seeing definitely, if there's a big bad bacteria that's in there that's overgrowing, that's something that I can treat, or a parasite that I can treat. But mostly what I'm looking for is inflammation levels. And so when I see high degrees of inflammation, that is the one thing that I can explain to them. Like, this marker tells us if you might be more prone to ulcerative colitis or Crohn's disease or IBS or whatever it is. And then I can help them to understand that most of their time it's because of what we're eating that's driving that, or maybe even what we're not eating, or not having a healthy balance between sugar and, our intake of protein or whatever. So we try to drive. I think 90% of what I do is how to eat. I am just shocked. And I really just don't think people know what's they're supposed to eat and what they're not supposed to eat. Do you find that to be kind of true? I feel like I guess for me growing up, I ate a very healthy diet. My mom always made fresh food, fresh vegetables. We had fruit, so for me, it's very interesting to know that it's normal for people to think that eating McDonald's every day is okay, that that's just a normal thing to do. So I guess education is so important about how what we put in our mouth affects, what's going on in our gut.
Yeah. And what I find amazing is what you just said is you can actually see that on the stool test.
Oh,
and I think you've seen it too. You could repeat those, like you said, ultra processed foods. One, they're so hyper palatable. People, once they come to me, start eating them. It's like a snowball rolling downhill. They can't stop. That's part of the problem. But the other thing is just time. Everybody nowadays is so busy. Oh, I just don't have time to cook, or I don't have time to go to the grocery store, even though they have delivery and everything else nowadays for grocery stores.
Right.
They just don't have the time. But you and us, I know, to me, it's no different than your savings account for you to retire later. And I don't mean to be dumb. You can have all the money in the world and retire with a lot of money, but if you don't put money in your health bank account now by eating better, and you go to retire, I don't care how much money you live, and you see this, people can have all kinds of money, but have a horrible health. And that's not a fun life. That's a miserable life. And there are so many things you can do.
Bad bacteria to take over the good bacteria, what we call dysbiosis and all of that. And I think that the media has fueled that if we don't eat these things, then we're depriving our body, right? And everything we do centers around eating. So instead of let's get together and take a walk, it's let's get together and go to lunch, or let's go to dinner, or let's go to happy hour. And I think that's what's driving a lot of what's going on. So then they think, oh, well, I can't go drink alcohol, or I can't go have pizza, or I can't go do this. And so that I can't live my life, And why is our life, why has this become our life? I think this is the question we all need to sit back and answer. Like, wait, what happened to just eating real food? Where did it go? Where did that change? That's when we see really the major changes of what's happened to us and all the chronic health issues that we have.
Yeah. And I think that's where a lot of the food industry really has hijacked that whole hedonic urge, where we're just made to seek food. But like you said, and it just made it now where we almost connect food with living. And like you said, and I say this all the time, and you've heard this one, it's whether you want to eat to live or live to eat. And that's the mindset. And that's what kind of gets wrong. So you've done gut tests, they're inflamed. You've looked at blood markers, they've got autoimmune conditions. So I'm going to throw out a couple of things like your approaches to treating these. So they've got an autoimmune condition. We need to start attacking it. We've already kind of talked about diet. If you had to sum up what kind of diet you recommend, I've heard you say whole foods. Is there any particular diet or style that you think is best to help reduce? I know there's like the AIP diets, which are like hardcore. Like I have to admit, like I couldn't even follow an AIP diet. But for you, is there any diet or eating style that are like kind of a must if we're going to get from point A to point B with autoimmune conditions? This is what you're recommending?
So it depends on the degree of inflammation. If I can convince them to do AIP for about 2 to 4 weeks even, I think it's helpful to drive down some of the inflammation fairly quickly. And thankfully, there's a company called Paleo on the Go, which you just order your meals and you eat them. So if I can get them to do that, that's huge. If I can't, then my go-to diet is always going to be paleo. So, getting rid of the dairy, getting rid of the grains initially, at least, eating a whole foods, getting rid of the sugar. That's my first goal for them, is to really drive that. So I try to do sort of like a yeast-free diet, paleo diet. Those are probably my 2 favorite things to work on. And it takes a lot of convincing. And we have a nutritionist here who I actually have them go with them to the grocery store so I can have them focus on what they can eat versus what they can't eat. Because I think when they get so, overwhelmed with, oh, well, I can't have this and I can't have that. And I'm like, okay, let's forget about what you can't have and let's focus on what you can have. So that's what I want to get them to do. So I try to make it a little bit more, I guess I would say, tougher initially. And then I want to put them on what I feel is going to be more realistic for them to follow. And so many people can continue paleo. Sometimes I'll have them bring beans back in, or a little bit of grass-fed dairy, or some of the grains. I've had some people do really well, and then I'll just have them try a little bit of flour from Italy or France instead of American flour. And occasionally then they can have real bread or whatever, So I think once I have them healing, then I try to make life more palatable for them. Some of them feel so much better that they will never put artificial colors, dyes, anything back into their diet. And they're really good about keeping their sugar under control. I think where I lose people is the holidays or their birthday. And then after that, it's tough to get them back on track. But I think they start to feel so much worse when they put junky food back into them that they were like, okay, I know I was much better. I'm just going to get back to that. So, it's a roller coaster. It takes a few times for people to get to where a lifestyle of eating whole foods is really what we want.
Yeah, I think the key, like you mentioned, is, no, you're good. I think the key is having them stick with something as long as possible so they can be as clean as possible. So when they add bad stuff back, they feel as worse as possible.
Correct.
So,
Correct.
I mean, it's really said to be that way, because if you eat clean for a couple of weeks and eat bad, it's not a big deal. But if you eat 10, 12 weeks clean and you eat something bad, your body's
you're going to feel so bad. Yeah.
What are you doing to me?
Right.
No, that's excellent. So we're going to play a little game. So we're going to talk about autoimmune conditions. I'm going to throw out something. I want you to rate it from 1 to 10, how important it is, and just like a sentence or two, why. So let's pick autoimmune conditions, sleep. How important, 1 to 10, and then why?
Sleep is so important because when you sleep, your body has a time to really do something called autophagy and clean up all the ugly bad cells and junk that's in there. And we have time to reset and rebuild the immune system. So if you're sleeping 3 hours a day, that's not going to work. So sleep, I would say, is definitely a 10.
Very good. All right, next one for you, stress. How important is stress in terms of autoimmune
Oh,
conditions?
well, stress is always going to flare an immune system, right? Flare your immune system. So, stress control. I mean, obviously, stress is not going away. It's not going away for you. It's not going away for me. It's not going away for anybody. But trying to do something to manage that stress is critical. So, trying to do some type of quiet meditation, yoga, reading, whatever takes you away and escapes from the world for a few minutes a day is critical to rebalancing your adrenal gland and helping your cortisol production and all of that. So stress is also a 10, but it's really learning to manage the stress. That's the most important thing.
All right, here's one for you. How about exercise? How important do you think exercise when it comes to autoimmune conditions?
So exercise with autoimmune is really important, but it's what kind of exercise, which is critical, right? So are we going to get out there and do head exercises and jog 55 miles? No, those are not the things to do when your immune system is under attack. We need to do gentle, restorative yoga. We need to do Pilates. We need to do walking. We need to do more gentle exercises to help heal the immune system and not try to overdo it because then we're just burdening the body again with more stress and more cortisol.
Okay, I got one more for you. I know this one's going to be important. This is in your wheelhouse. How important do you think hormone balance is when it comes to autoimmune conditions?
Well, that is $1,000,000 question, right? So everything right now is menopause, perimenopause, and andropause, which we've been dealing with since, 21 years ago. But your hormones are going to change when we are stressed, when we're not eating right, when we're attacked with all of the, with all the internet, with the, phones, with the chemicals, with everything that we're doing all day long. Your hormones are not going to be working efficiently for you. So hormone balancing is huge, very critical part of getting your immune system to regulate for sure.
So you giving that one a 10?
10, absolutely. So stress 10, sleep 10, nutrition, exercise 10. Yep, they're all 10s, unfortunately, right?
So here's one for you that I think for me is kind of newer and for you also. What role do you think toxins play in autoimmune conditions? How important is that?
Well, it's sad to know that we're living in a world that's so polluted, that is so full of chemicals that we shouldn't be using, right? So I tell people this all the time. If you go to Europe and you buy their skincare, you buy their sunscreen, load up and bring it back because they don't allow over 500 of the chemicals that are allowed in our products that we use every day. I mean, the food is a, totally different situation. Everything there is fresh and seasonal, and they don't have genetically modified wheat and sugar and soy and all of the things. So, everyone tells me when they go to Europe and they walk around and they eat everything they want, they feel great. They don't feel bloated. They lose weight. They don't have inflammation. And they come back here and immediately it's back to the way it used to be. So, I think that chemicals and toxins are huge. And so, we're testing for that. And thankfully, you guys have partnered with MD Lifespan and offering that TPE now to help, get rid of the toxins, which of course, not everybody needs something so aggressive, but we do a lot of mold detox, simple heavy metal detox, environmental detox. So the first and foremost thing I have to tell people is please get rid of your plastic. I'm just shocked at how many people still use plastic to store their food in, to microwave it, to freeze it. I'm like, this has been known forever. So go through your kitchen, get rid of your plastic cutting boards, get rid of your plastic bowls, get rid of your plastic spatulas, just toss them. And let's start.
I cringe. I'm the same way.
Replace them now. Like get some wood cutting boards, get some silicone spatulas. It's really so easy now. Stainless steel. It's not expensive. You can, it's very affordable to get rid of that stuff. But I think again, people just think that's what they're supposed to use, but it's not.
I walk into my break room and I see my staff eating some kind of plastic. I just cringe.
I know.
I'm like, oh, what are you doing? Like you can't, especially eating it. It's like, that's the worst thing.
I'm like, that's it. No more. We're going to go buy you some Pyrex. There's just no way we're going to be using this plastic in this office. Nope,
no,
not doing it.
That's for sure. Yeah. So let's jump in a few pharmaceuticals and one supplement. I think one of the most underutilized, cheapest things people can do is optimize vitamin D for autoimmune conditions. What is is the vitamin D check, is that pretty much an essential thing in your office?
Every day, all day, right? So I think the unfortunate thing is people think, oh, okay, so my vitamin D level's low. I'm going to take this dose for a while and then I'm going to be fine. Well, guess what? That's not what's happening. So our vitamin D is always going to be low unless we replace it. For most people, unless you're outside in the sun 30 minutes a day getting your maximal skin exposure, and then even you may not get to an optimal level or 60 to 80, right? And so I think we have to pretty much supplement anywhere from 2 to 5 to 10,000 a day. But we have to monitor that because too much vitamin D is not good either. So it's definitely something that we have to get in the right range and then keep it there and monitor it.
Yeah, patients come to the pharmacy all the time and I'm like, I'm taking vitamin D. And I'm like, okay, but when did you check? Oh, I've just been taking it. I'm like, no, like you've got to check because you could still be low or you could be high. And it's like you need just the right amount. And I think that gets missed a lot.
You have to take it with a meal that has fat in it.
Yep.
That's critical too. So many people just take their vitamins, throw them down before they leave the house, don't eat anything. And they're like, oh yeah, I'm taking my vitamins. Well, that's not going to work. So you need your vitamin D with fat. For sure.
Exactly it. That's why a lot of times I recommend them to take it. Well, I like vitamin D in the morning because it just mimics what the body does. But vitamin D with your omega-3s, because that's another thing to reduce inflammation.
Right.
And I think that's a great way to help improve that absorption.
Yes, for sure.
So you and I got put on something. We talked about this a while back, and I think it's a big impact for our patients. When people have autoimmune conditions, we work on all these diet, we work on all this lifestyle, but once again, you can still have underlying factors while we're working on things. You can have infections, different things. But we talked something about you either can put somebody on a biologic, which will pretty much just shut the immune system off. It's like, hey, immune system, go get in the corner. We don't need you because we're tired of you, i.e. causing psoriasis, Crohn's disease. But we need the immune system. It's super important. But one of the options we have is something called low-dose naltrexone. Tell me what that does and why you think it's important for your patients.
Low-dose naltrexone is incredible. So, first of all, I have to tell people what low-dose naltrexone is. Naltrexone, the drug, is used for addiction, for alcohol, for alcoholism, for overdoses. So I try to explain that to them because, unfortunately, now they go to other doctors who say, "Oh, are you an addict of some sort? Why are you taking this drug?" Right? So I actually make them go to the website, print off the page, the LDN Research Trust, and say, "Here's what I'm taking, and I'm taking it for inflammation." So low-dose naltrexone is compounded in exactly that, low doses, to be an immune modulator. So it takes an immune system that's not working and helps to improve it. It takes an immune system that's overworking and helps calm it down. It does exactly what your body needs. And we have to find exactly how much you need. And that could be 0.25 milligrams. It can be 1 milligram. It could be 4 milligrams. But we know that we titrate it pretty slowly. I know some people start it a little bit higher, and I don't like to do that. I feel like it's important to start it low, give people time to get adjusted to it. I usually like to have them take it where they don't have, I know that one of the side effects that I describe to people is the very vivid, intense dreams you can have. So some of my patients take it in the morning, some in the afternoon, some do take it in the evening. But that's a whole discussion I have with them. But low-dose naltrexone as a whole is going to help get your inflammation markers, down. And that is a cornerstone of what I use for autoimmune. So I'm usually able to work with that, nutrition, supplements, and we see a huge improvement in their immune system for sure.
Yeah, one thing I want to add about low-dose naltrexone, just in terms of it allows your immune system still to work, so it doesn't shut it off, but it does calm that inflammation.
Right.
Yeah, and that's so powerful. It modulates it. And then the other thing I'd agree is we see more and more sick, challenged people. I would use an analogy. They're allergic to water. We're starting to see lower and lower starting doses of LDN.
Yes.
Because the thing that I found is if you start too high, you'll typically have side effects. It don't mean you can't take it. It just means it's more than what you need in your body. Even though, we're talking like micro grains of sand amount in a capsule, it is that powerful in the fact controlling your immune system. So sometimes we just need, lower amounts to get where we have to get. So that's a great call out.
But not suppressing your immune system is huge because I don't think people are ever realize what that means. That means you're going to get sick more often. That means you're more prone to get infections. That means you're more prone to get cancer. So I don't think they put that together. And that's really concerning if they're 30 and they're put on an immune suppressant. It's not good for you for the rest of your life, for sure.
So if you're a person listening to this podcast and we've said some things, you're like, ooh, that's me. What are those early warning signs that it's, hey, if you've got these things going on, you really need to take a deeper dive to roll out an autoimmune condition? What in your mind are those things that people really need to not ignore, but pay attention to?
Well, I think if you're losing hair, I think if your skin is changing, I think if your joints are hurting, obviously if your bowels are changing, you're exhausted, you can't do the things that you normally used to do. I think these are all signs. These are not normal things. Like a lot of people just say, well, I'm getting older. I'm 45. I'm like, seriously? At 45 is not getting older. Okay. So it shocks me that our attitude is as we get older, we're supposed to get slower. We're supposed to be tired. We're not supposed to do things. We're just supposed to sit around and eat our bonbons and our rocking chair. No, we're not. You're supposed to be 99 and out there, seeing your friends, having your coffee with your friends, eating, drinking, cooking, doing your own laundry. That is what you're supposed to do until the day you decide to not be on this earth. That's our goal.
Yeah, I was at a place a couple of weeks ago and got teamed up with somebody playing golf, and this guy's teeing up with me playing golf. And I asked him a question. We're about halfway through the holes, and we get to talking about kids, and he's talking about his kids are like 25 years older than my kids. And I'm like, how old are you? And this guy's 81 years old.
Wow.
Playing golf out there with me. And I realized, it's all about taking care of yourself, because getting old doesn't mean you're stuck in a rocking chair and poor quality of life. And it's all the things you're talking about, whether it be autoimmune conditions, gut conditions. If you'll take care of those things, we're supposed to be healthy, active, going and getting when we're in our 70s and 80s. There's no reason you can't. And that's what I think this whole functional medicine personalized approach does. It looks at all these systems because they all work in tandem. And if you can keep them clean and keep them healthy, then you've got a chance to live a long, healthy life. And I know that's what you're doing in your practice. And I think that's really awesome.
And that's the key. We want you to live a long, good quality, life. We don't want to be not having a good quality of life in your 70 and 80. And that's just, you don't have to do that. There's so much we can do now. There's so many markers we can change. We can regulate your gut. We can regulate your immune system. We can regulate your hormones. There's so much we can do so that you can live your very best quality of life, like I said, until the day that you're not on this earth.
And all that stuff you mentioned is so key, because honestly, you can have the worst genes, but you can totally work yourself out of that. Like it doesn't have to be your destiny. That can just be what you were given at birth.
Yeah.
As far as that
I really
goes.
do hate the word old, because I think people just hear old and they think, oh, that means that I'm not supposed to do anything. And that's, again, most cultures, it's not like that, right? If you go around the world, there's no such word as old. They just started, to continue to do everything that they normally do. So they don't really look at that. They just think, okay, I'm 45 today. Today I'm 95. I'm the same person, right?
No doubt about it. Well, you do awesome work. I work with a lot of your patients. I'm privileged that we share a lot of patients, and that's really awesome. But if people want to learn more about you, where you're at, what you do, Sakina, what can you tell me about that?
So we are at Woodlands Wellness and Cosmetic Center. Our phone number is 281-362-0014. Give us a call or go to our website, which is woodlandswellness.com, and come see me.
This is awesome. And I think at the end of the day, your body is always given signals, and it's kind of up to you if you want to listen or you want to ignore. And it's even more important to go to somebody that will interpret them properly. And I hope if this resonated with you today, that, listen to this, listen to your body, but more importantly, if you know somebody that needs this message, share it with them, because I think it's so critical for you to start looking at how your body's working, the truth about how it works, to set you up for success as you get older. And I just want to thank you so much for joining me today.
Thank you so much for having me on. It was a pleasure.
Awesome. Have a great day.
You too.